Now, recently we have lost 2 Agniveer trainees, and it is suspected that they have died because of meningococcal disease. So in this respect, the Meghalaya state government has increased the disease surveillance. This particular topic you can associate with the general science segment of your prelim syllabus. Now, when you talk about this disease, it is a rare but serious bacterial infection. It is basically caused by this bacteria, Neisseria meningitis. And it basically causes the membrane, which basically covers our brain and the spinal cord, to inflate. And that is the reason it becomes a serious disease. There are 2 types of infections. One is meningitis, another one is septicemia, which leads to poisoning of the blood also. Although they are rare, but they are very severe, okay, because the bacteria would be impacting the body in a very short period of time. And about 1 in 10 people, they have this bacteria at the back of their nose without being ill. But the moment it attacks your body, then it takes very less time, okay, to make you very severely ill. Sometimes it evades the body and cause the illness. Now, when you talk about the transmission, it is basically transmitted through saliva or spit. If you are sharing cigarettes, if you are sharing, used glasses, etc. So that ways it can be spread. Now, when you talk about the symptoms would be fever, headache, stiff neck, bothered. You will be bothered by the bright light, which is also known as photophobia, nausea, vomiting, diarrhea, and a rash made up of pinpoints that look darker, and it would be in the shade of red and purple. Now, the government, okay, the PIB websites points out that since this disease progresses very rapidly, it would take roughly 12 hours, okay, to bring you in a very serious situation. So that is the reason the government has pointed out that if anybody is witnessing any of the 2 symptoms, please, meet a doctor immediately, as soon as possible. And when you talk about this particular disease, it's not like it is for the first time we are witnessing this disease. Previously also we had this, outbreak. So we witnessed the outbreak of this particular disease in 1980s also and in 1966 also. Now, we have one vaccine to treat this, that is meningococcal polysaccharide vaccine, which is not used when it comes to children who are below the age of 2 years, okay, because it has not been that much efficient or effective when it comes to the infants who are below the 2 years of age, although it is effective when it comes to the adults. What are other ways to treat this particular disease? So it is treated with antibiotics apart from this particular vaccine, and oxygen therapy is provided to the patients, and drugs are provided to basically deal with the low blood pressure also. That's all that we need to learn in